From VOA Learning English, this is the Help Report. Malaria can be both prevented and treated. Yet, the disease is still the third biggest killer of children in the world. There's a lack of good information about malaria in some areas. Malaria is spread by bites from mosquitoes. The insects are less likely to bite people who sleep in beds covered by special chemically treated nets. Susan Eckhart is a United States Peace Corps volunteer in the West African nation of Burkina Faso. Malaria causes about 9,000 deaths there every year. Ms. Eckhart says people there depend more on treating malaria than preventing it. She says when a sick person reports a high body temperature, the person is given medicine to treat malaria. Patients are given the medicine at the first sign of sickness because it costs less than the test used to identify the disease. Peace Corps volunteers are trained so they can be involved in public education campaigns. Ms. Eckhart presents information about malaria in fun ways to help the children remember. She works with students from 1st grade through 5th grade. Older girls and boys who received training at a leadership camp help her with the malaria training. The older children present the malaria information in the local Dagara language. They wrote plays and sang songs about malaria. It is too soon to tell how much of the information in the songs and games is shared with families. But Susan Eckhart says it is a good idea to use Peace Corps volunteers to help prevent malaria. Being part of the community means sharing knowledge, she adds, especially about something as important as malaria. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is the Health Report. A new study has found evidence of aggressive behavior in children who drink 4 or more servings of soft drinks every day. Information for the study came from the mothers of 3,000 5-year-olds. Researchers asked the women to keep a record of how many servings of soft drinks their children drank over a 2-month period. The women also were asked to complete a checklist of their children's behavior. The researchers found that 43% of the boys and girls drank at least 1 daily serving of soda. 4% of the youngsters had 4 or more sodas to drink every day. Shakira Sulia is with Columbia University's Mailman School of Public Health in New York City. She worked on the study with researchers from the University of Vermont and Harvard University School of Public Health. She says they found that children who drank the most soda were more than 2 times as likely as those who drank no soda to show signs of aggression. The aggressive behaviors included destroying possessions belonging to others, taking part in fights, and physically attacking people. Dr. Sulia says the researchers identified the link after they considered socio-demographic factors, like the child's age and sex. They also considered other possible influences, such as whether the boys and girls were eating sweets or given fruit drinks on a normal day. In addition, the researchers examined parenting styles and social conditions at home. Dr. Salia says it is not clear why young children who drink a lot of soda have behavior problems. But she says the ingredient caffeine could cause children to be more aggressive. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report. Organ donation is big business in China. There is a high demand for organ transplants, body parts that are given from one person to another. But the donation rate is very low. So for years, China depended on organs from prisoners who had been executed. Now, that has changed. China announced recently that it will stop using the organs of executed prisoners. The China Daily newspaper says the government now will accept only voluntary organ donations from citizens for transplants. China's former Health Vice Minister Huang Jiafu leads a new government group, the Committee of Human Organ Donation. The committee will create policies and rules on organ donation and use. China has one of the world's lowest rates of organ transplants. Mr. Huang says distrust of the donation system is the main cause. Dr. Gabriel Danovich is a doctor at the University of California, Los Angeles. He is also a member of the Transplantation Society. The organization is working with the Chinese government to establish an organ transplant registry similar to those in the United States and Europe. Dr. Danovich says China needs to change the organ donation system and stop depending on executed prisoners for organs. He says China's system currently serves mainly wealthy people. They come from all over the world to pay a lot of money for those organs, he says. But now, if Chinese prisoners donate their organs, their body parts will be registered in the system instead of being used for private trades. Huang Jiafu told reporters that this is the main difference under China's new organ donation system. For VOA Learning English, I'm Jonathan Evans.
From VOA Learning English, this is the Health Report. American scientists have, for the first time, taken stem cells from human embryos that are genetic copies of living people. The goal is to create better treatments for disease. But the work has raised ethical concerns about cloning or making genetic copies of people. It is illegal to clone a human being in more than 12 states. some medical researchers are carrying out what is called therapeutic cloning to try to fight disease. Still, even that method is banned in 7 states. One state where therapeutic cloning is not banned is Oregon. Researchers at Oregon Health and Science University in Portland were able to put human DNA into modified human eggs. They produced embryos that were genetically the same as the people who had donated their DNA. The researchers then took stem cells from the embryos. These cells are called master cells. Scientists know how to use chemicals to cause master cells to develop into any tissue in the body. The idea is that doctors could use tissue created this way to replace diseased organs. The new body tissue would be a genetic match of the person receiving it, and there would be no danger that the patient's body would reject the new tissue. That can happen with normal transplants. Shukrat Matalapov led the study, which involved more than 20 researchers. The scientists believe the stem cells could give doctors a new way to treat Parkinson's disease, a degenerative movement disorder. Scientists believe they could use the DNA from a skin cell of someone with Parkinson's disease to create a personalized treatment. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. A new study finds that drinking coffee can help you live longer. The research comes from the Harvard School of Public Health. It says that drinking between 3 and 5 cups of coffee a day may prevent certain illnesses. The researchers found that coffee can protect against heart disease, brain diseases, type 2 diabetes, and suicide. Walter Willett is a nutrition researcher at Harvard and co-author of the study. Willett says the findings extend to both caffeinated and decaffeinated coffees. The health benefits come not just from the caffeine in coffee, but from compounds in the beans. Frank Hu is the senior author of the study and a professor of nutrition and epidemiology. He studies how food affects illness. He says the research adds to a growing body of evidence. It finds drinking a moderate amount of coffee may have many health benefits. One benefit is having a longer life. But he says moderation is the key. Andrew Maynard is a professor at Arizona State University. He told National Public Radio that the health benefits documented in this new study are small. He also said it does not prove cause and effect between drinking coffee and living longer. Rather, it points to an association or link. Even those involved in the research have questions. When National Public Radio spoke with study co-author Walter Willett, he said he is not sure how coffee is linked to certain health benefits. Willett says that if you like coffee, do not feel guilty about drinking it in moderation. If you do not like it, there is no need to drink it. For VOA Learning English, I'm Jonathan Evans.
From VOA Learning English, this is the Health Report. The number of overweight children in the U.S. is growing. That is the reason the American Heart Association and the Clinton Foundation created the Alliance for a Healthier Generation. Over the past 10 years, the Alliance has been coming up with creative ways to fight childhood obesity, which means being severely overweight. One way to fight the problem is to invite young people to be part of the solution. 12-year-old Jody Evans has always been active. She loves to exercise and play sports. Jody is on the Alliance for a Healthier Generation's Youth Advisory Board. The Alliance chose her for her healthy lifestyle and her involvement in sports. Megan McIntyre is spokeswoman for the Alliance. She says the young people in the Alliance share their ideas on how to fight childhood obesity. She says they are having a tremendous impact across the country. The young Alliance members talk about making healthier food choices with their friends. Ms. McIntyre says this is very important. 1 in 3 children is overweight or obese in the U.S. The goal of the Alliance is to help children create healthier environments for themselves. Ms. McIntyre says they are doing this by increasing physical activity. The young Alliance members are also bringing healthier food choices to where students eat and buy food, in school lunchrooms, vending machines, and bake sales. Jody has a gentle, friendly approach. This makes it easy for others to listen to what she has to say. For VOA Learning English, I'm Ann Ball.
From VOA Learning English, this is the Health Report. Even in the world of medicine, what is old is new again. Thousands of years ago, Egyptians used copper to sterilize drinking water. They knew copper could destroy bacteria in the water. Ancient Romans, Aztecs, and Greeks used forms of it for medical treatments. Copper may kill many organisms on contact. Now it is back in hospitals to do just that. Bill Keevil is a microbiologist at Southampton University in Britain. He is investigating the properties of copper. He has been investigating how the metal can kill germs, or pathogens, as researchers call them. Keevil points to studies of infection rates at U.S. hospitals that use copper surfaces and hospitals that do not. He says the studies found that surfaces made of copper alloys produced a 58% reduction in infection rates. The findings were published in the journal MBio. Keevil and his research team found that copper surfaces can quickly kill the coronavirus 229E. The coronavirus is responsible for the common cold and pneumonia. This virus is also closely related to the pathogen that causes SARS and MERS, two sometimes deadly diseases. Keevil says that electrically charged copper molecules, or ions, can kill these viruses. He says they do this by destroying their genetic material. As a result, the genetic material in the coronavirus 229E cells cannot change or mutate. Keevil calls the chemistry that does this fantastic. Bill Keevil says copper can also save hospitals money by reducing the number of infections. He says their other costs of fighting infection will drop, including those for drug treatments. For VOA Learning English, I'm Jonathan Evans.